In the last 20 years, there has been a significant change in the face of pressing health concerns worldwide. Non-communicable diseases, including cardiovascular disease, cancer, respiratory diseases, and diabetes, now account for 71% of deaths globally. Today, 425 million people are living with type 2 diabetes around the world, and if nothing is done, this is projected to increase by 48% by the year 2045. That is, more than 629 million people will be living with diabetes. Central America, for example, will see an increase of 62%, while in Africa, the projected increase will be 156%. The key to shifting our understanding is realizing that 3 out of 4 people living with diabetes today now live in low and middle income countries, with the onset of disease shifting down a generation, increasingly affecting those in their most productive years of life. Moreover, 1 in 2 adults with diabetes throughout the world remains undiagnosed. This is where we come in. Bienestar, which means well-being in Spanish, is a non-profit, volunteer-run community health organization out of the West Kootenays that started in 2015 as a means to support locally identified initiatives in Guatemala that contribute to enhanced wellness through improved health, education, capacity building, and sense of agency for the people. Our partners are those with whom Selkirk College Nursing has been working with since 2006 to provide a community health student nursing practice experience. Why Guatemala? Guatemala has one of the highest rates of disparity in poverty in Central and South America. The richest 1% of the population has income equal to the sum of the poorest 40%. More than 1/2 of the population lives below the national poverty line, with 23% of them living in extreme poverty. 47% of the population is indigenous, and poverty among them averages 79%, with 40% living in extreme poverty. According to the UN Food Program, 46.5% of the children under 5 are stunted, and we are now seeing the double burden of malnutrition and obesity. Almost half of Guatemala's population is under age 19, making it the youngest population in Latin America who is facing limited formal employment opportunities and pervasive gang encroachment. The backdrop to these statistics and social and economic disparities underlying them is the brutal civil war which took place between 1960 and 1996. In 1999, the United Nations concluded genocide had occurred and determined the state was responsible for 93% of the human rights violations. The guerrilla forces were responsible for 3%, while the remaining 4% are unaccounted for. Bienestar's work is currently focused in the cooperative of Nuevo Horizonte, a small community of 500 people that was founded in 1998 by some of the members of the guerrilla forces following the signing of the peace accords. It is situated in the Petén, one of the 22 departments of Guatemala, which comprises 1/3 of the landmass but only 10% of the population. A lowland tropical rainforest known for world-renowned Mayan ruins such as Tikal, rare species of flora and fauna, petroleum, and cattle ranching, the region also has dubious distinction of having the highest maternal mortality rate in Guatemala and an estimated rate of 60% of malnutrition among the children. Over the last 20 years, the achievements of the Co-op of Nuevo Horizonte include construction of single-family cinder block homes with potable water, community center, elementary school and high school, youth center, health and maternity clinics, and a number of local and economic initiatives, legal title and self-governance, and established green space. Projects funded by Bienestar to date include a student scholarship program to assist with the high cost of education, support for youth programming including funding for a female youth soccer team, purchase of costumes for the folkloric youth dance troupe, limited emergency medical funds, and as of April 2018, a diabetes health and wellness program that is aimed at both prevention and management.
As noted previously, diabetes is a global epidemic, and Guatemala is no exception. The age-adjusted rate of diabetes is estimated to be 10.2%, while the proportion of deaths due to diabetes in people under 60 years of age is estimated to be 62%. As a result of the achievements of the cooperative, the population is strikingly healthy overall. Unfortunately, this is changing. In 2013, during the sharing of meals with families, the nursing students discovered that many adults in the community had developed diabetes in what seemed to be overnight. They didn't know why, who was next, or how to protect their children, and they were scared. According to them, the medical information they received was, take these pills and don't eat sugar. And so, we initially collaborated with the Cooperative of Nuevo Horizonte in the spring of 2014 to carry out a diabetes and cardiovascular screening and to offer interactive diabetes-related health education activities with the youth and community at large, along with the creation of a mural on the women's store depicting health as a collective human right. I will never forget when, in the midst of one activity with the high school youth, where we were examining the amounts of sugar in soft drink beverages that are produced by the transnational corporations and which are now ubiquitous to daily life, when one of the students exclaimed, "I get it. They killed my grandparents in the 80s with guns during the Civil War, and now they're killing us with pop, but it's the same thing. We are dying, and they are profiting." Of the 100 participants screened, 30 had diabetes, 6 of whom had been previously diagnosed, and an additional 4 had prediabetes. The news was, as you can imagine, devastating to some and very sobering to the community as a whole. However, the story was not over. The people living with diabetes have initiated informal peer support and regular walking groups, facilitated outreach to surrounding Indigenous communities, and shared responsibility for monitoring their blood sugars, while the cooperative members have brought in more vegetables to sell at the local stores, and the high school teachers have mentored the youth to start family gardens. This is significant, as Guatemalan subsistence farmers primarily plant corn, beans, and squash and are reluctant to diversify. The reason being that vegetables will not sustain life during a bad harvest. However, a bit of corn and beans will. Research on the efficacy of the diabetes health education workshops was presented at the 2015 IDF conference in Vancouver by Jean and Marianne through a poster presentation illustrating the statistically significant reductions in weight, body mass index, and waist circumference following the first 4 months of intervention. From the outset, we have been struck by their level of organization, involvement of the community as a whole, and their insistence that we not worry too much about them, quote unquote, but rather focus efforts on prevention with the children. Our involvement culminated in 2018 with the development and funding of the Diabetes Health and Wellness Project, a collaboration between Bienestar and Nuevo Horizonte. It includes a diabetes health promoter training program, opening of a diabetes health and wellness center, hiring 3 part-time diabetes health promoters, securing a physician with specialty training in diabetes management for primary consultation, and establishing a supply chain of low-cost oral meds, insulin, and syringes. The Diabetes Health Promoter Training Program took place in March of 2018. It was 2 weeks in length, full-time, and involved 23 participants from 5 different villages, 21 of whom graduated. We addressed the conventional topics in a dynamic, interactive, and hands-on way that took into account limited literacy and was reinforced daily with interactive, group-based evaluative activities, which demonstrated their growing knowledge and skill set, and also enabled them to gain a sense of confidence and competence. All of this was done within the context of prioritizing the important but seldom addressed issues of living with diabetes in the family, addressing myths, working through a train-the-trainer model of participatory education, focusing on prevention aimed at children and youth, and working effectively with people who have limited literacy. key was including opportunities for the participants to develop and practice health education with the children. For example, in one session they talked about garbage on the streets, much of which were the plastic bags and bottles from edible products. They connected the idea of garbage for the environment being garbage for our bodies, and illustrated this by burning chips, which offloaded a dark, foul-smelling smoke. The children were duly impressed. And as a means to increase family vegetable production, we built a prototype of the keyhole garden, a design common throughout Africa and Asia, which maximizes water conservation and soil enrichment, two significant limitations to food security in the Payten. The Diabetes Health Promoter course was facilitated by Jean, Marianne, and Esther from the West Kootenays, and Melina and Julieta, two Indigenous diabetes health promoters from the Organization for the Development of the Indigenous Maya, or ODIM, an American Guatemalan NGO health organization based by Lake Atitlan that has offered a radically new model of diabetes health education and support programming for more than 300 patients with diabetes.
The Diabetes Health and Wellness Center opened shortly thereafter. Through the center, the diabetes health promoters facilitate wellness programs including an exercise club, children's club, women's club, and people living with diabetes club. They are starting to collaborate with the traditional midwives at the local maternity center to provide screening for gestational diabetes and are working with the garden. They also accompany people living with diabetes to their medical and lab appointments, liaise with Dr. Calindres about ongoing blood glucose results and medication adjustments vis-a-vis WhatsApp, respond to diabetes-related medical emergencies, offer low-cost oral medications, insulin and syringes, and carry out monthly biometric and foot care evaluation and education. The costs for the program are being managed by all involved. The clients pay for their own test strips, oral medication, and transportation to appointments. The community provides the building for the Diabetes Health and Wellness Center along with the renovation of it and oversight of the project. Dr. Calindres, the internist involved, provides a 1/3 reduction in cost for medical appointments and free selective antihypertensive medications for 4 of the patients. The diabetes health promoters provide their own personal phones and a computer, and numerous volunteer hours above and beyond their limited 12-hour per week salaried position. Bienestar covers the cost of the healthy snack and material resources for the clubs, internet and phone coverage, patient lab and medical expenses, and the salaries of the diabetes health promoters. To put the costs of diabetes medication management into perspective, an A1C is $15 and a glucometer check is about $1, while medications, when available, are similar to those in Canada. However, most people are making about $10 a day through seasonal labor. A 6-month evaluation as of September 2018 from the Diabetes Health Promoter Team indicates that, on average, 20 children attend the weekly children's club where they focus on making a healthy snack, exercise, art, and discussion of themes relevant to health and wellness. The Diabetes Health Promoters note that there is increased participation, confidence, and trust in the children as expressed in their art, verbal comments, and interactions amongst them. Close to 50% of the people living with diabetes attend the weekly diabetes club, which focuses on 30 minutes of exercise in 3 10-minute segments, preparation of a healthy snack, peer support, and discussion of themes which have included depression, anxiety, focus on a healthy diet, low-cost healthy foods, managing neuropathy, self-esteem and motivation, and healthy living goals. They view themselves as leaders regarding diabetes prevention, and their motto is, to prevent diabetes, live as if you have it. Slightly more than 50% of the people living with diabetes have continued to maintain or further reduce their weight loss and have lowered their A1C levels. Approximately 30% are participating in the group exercise program that is offered for 1 hour, 5 days a week, alongside, on average, 12 other women, the occasional male, and numerous children. 25% of women from the co-op attend the monthly women's club on average. Themes have included healthy local diet on a limited budget, reflecting on the foods readily available, both healthy and unhealthy, and what is stress and stress management techniques, all within the context of the women's own experiences. There is excellent attendance at the monthly biometric check and foot care clinic. There has been no evidence of foot ulcers despite widespread neuropathy, with high rates of reported adherence of daily foot care, assessment, and protection. A very poor crop in the Keyhole Garden was attributed to decimation by the free-range chickens, and they are now in the process of building a fence.
The Bienestar supported diabetes health and wellness program in the Cooperative of Nuevo Horizonte is not a panacea for addressing the stark social disparities in society that disproportionately predispose people who are poor to develop chronic diseases such as diabetes. However, the people of Nuevo Horizonte and we at Bienestar believe it is an important initiative, as it first and foremost speaks to the capabilities and pressing health concerns of people dealing with diabetes, a disease that is largely being ignored by the healthcare system in Guatemala and which is increasingly being exploited by private enterprise for profit. As recommended by the IDF and WHO, it supports the people themselves to play a central role in prevention and in the development of services to be delivered. It builds health literacy, the knowledge that is power, and it has the potential to be a model for all of us, regardless of wealth or opportunity. In conclusion, we look forward to collaborating with others who value this approach to international engagement, believe that another world is possible, and are committed to health for all. We close with the images of children from Nuevo Horizonte who are dressed in costumes of fruits and vegetables, a theme chosen by their school teacher and them for the community parade. One step at a time, shaping the future health of these children as they move into adulthood. This work is dedicated to the memory of Maria Teresa Alquilar, a practice partner who died unexpectedly at the tender age of 59 from complications of type 2 diabetes.